Today we will be talking about fibromyalgia. Fibromyalgia is a chronic disease that currently affects 5 to 10 million Americans. 80% of those affected are women and typically range from the ages of 20 to 55. It is currently unknown why so many more women than men experience the disease and why it occurs in middle age, so researchers are still trying to figure that out. Fibromyalgia is characterized by widespread chronic musculoskeletal pain as well as a variety of other symptoms. These symptoms typically include sleep disturbances, chronic fatigue, depression, anxiety, numbness and tingling in the extremities. People who have fibromyalgia also experience headaches. They can have memory loss. They can also be extremely sensitive to noise and light. And they sometimes have trouble coping with day-to-day activities because of all these symptoms that they face. The exact cause of fibromyalgia is currently unknown, so researchers are still trying to pinpoint exactly what it is that causes the disease. There are many theories out there of what could cause it. These include typically the symptoms start occurring after a major trauma, such as an automobile accident, a surgery, or an infection. So some researchers say that a trauma could be the trigger of the fibromyalgia. Also psychological stress, so if you're under a lot of stress or if you have changes in your sleep patterns, this can also trigger those symptoms to start. So in order to diagnose fibromyalgia, doctors want you to have experienced the symptoms of widespread pain for at least 3 months. So it doesn't need to be just a short-term experience with the pain. They want to make sure they're diagnosing you correctly. So they have specific areas of your body that must be experiencing the pain for the 3 months. And after that, they will determine the level of fibromyalgia that you have and ways to treat it. There are currently a variety of medications that are used to treat fibromyalgia. Typically, the pain is controlled with NSAIDs or acetaminophen, and they also prescribe some medicines that are typically used in epilepsy patients. So those also help with the fibromyalgia, as well as antidepressant medicines, since most of those people who have fibromyalgia typically experience depression and anxiety. So the medications are typically tailored to whatever symptoms that you experience of fibromyalgia. So if you just experience the chronic fatigue and the extreme pain, then you might just be placed on some pain medications. Doctors typically do not use opioid medications because these have proven to be ineffective in the treatment of fibromyalgia. Individuals who suffer from fibromyalgia often live very sedentary lifestyles and are often deconditioned as well, primarily due to the extreme pain they experience. Therefore, it is important to prepare an exercise test that takes this into consideration. For example, a muscular endurance test might be more beneficial than an aerobic exercise test due to the deconditioned level of your individual. Aerobic exercise tests can be completed using the walking or cycle test. However, if the individual experiences gluteal tender points, a recumbent cycle ergometer might be necessary to relieve some of the pain and to not cause any additional pain. Flexibility tests can determine the areas that might benefit from regular stretching. So those are also really important to use, as well as resistance exercises using. Due to the individuals who have fibromyalgia's typical sedentary lifestyles, it's important to plan the exercise test for a day when they don't have any other activities planned, because they're often going to be sore and worn out from the test, so you don't want that to impact their daily lifestyle. Also, none of the medications that most people take with fibromyalgia are likely to have an impact on exercise testing. So although you might want to monitor this and be aware of the medicines they're taking, they shouldn't have any effect on that. Light to moderate activities such as walking up and down the stairs, gardening, or just walking around the house are great ways to have your individuals that you're working with fibromyalgia still be physically active. Even if they are experiencing those symptoms from the disease, you still want them to maintain an active lifestyle as much as possible. When working with those with fibromyalgia, it's definitely important to know all about the disease as well as consult with the various healthcare professionals that your client might see. Those with fibromyalgia typically are going to have a rheumatologist they visit, a primary care physician, a physical therapist, and even an occupational therapist that they work with. So most of these professionals are probably going to have their own approach to the treatment of the fibromyalgia. So you want to take all these into consideration and use them to develop a training protocol that will help your client the most. Many people think that fibromyalgia and arthritis are one and the same or are closely related, which they are because they both affect the joints. However, fibromyalgia does not cause any damage to the joints or inflammation to the joints as arthritis does. So they are two different diseases. However, they are related because they do both affect the joints, muscles, and other tissues in the body. Individuals with fibromyalgia can benefit the same way that those in healthy populations do in regards to exercise. They can experience a reduced risk of diseases and improved oxygen consumption, as well as an overall quality of life, which is really important for these individuals because they often experience depression and anxiety. Aerobic exercises can include walking, water aerobics, cycling. These are all excellent ways to get your heart rate up and get those aerobic exercises in. These should last for about 30 minutes at the beginning, and they can be broken up into increments of 10 minutes apiece. Muscular endurance exercises can include weight machines, elastic bands, just whatever your individual is comfortable with and whatever their pain tolerance will allow. Flexibility exercises should allow the individual to extend their range of motion, and these stretches should be administered until any slight discomfort is felt. So you don't want the individual to experience any pain while completing the flexibility exercises, and these can be increased up to 5 days. Lastly, we're going to talk a little bit about comorbidity. With fibromyalgia, it is often very likely that the individual will also experience a mood disorder. So along with the depression and anxiety, they might experience bipolar disorder, generalized mood disorder, any of the above combinations. So it's really important to know this in the initial consultations with your clients because this can affect how you treat them as well as the exercise protocol. You definitely want to work with the professional team that the client has with them and determine the best approach to helping that client.